In a moment, I'm going to illustrate the 3 steps of the Miti crown and bridge impression taking system. Before I begin, however, there are 2 very important things to note. First, you may not substitute any other vinyl impression taking material or tray, or your results will be less than desirable. Number 2, whenever you use a auto mix tip with a vinyl impression material, you must bleed the cartridge, assemble the tip, and bleed the tip immediately before use, never at the beginning or in the middle of the appointment. Now we're ready to show you step 1. First of all, take your triple tray. You have now bled your cartridge, applied your mixing tip, and bled the tip for step 1. Fill the triple tray up to the level of the walls. Do not overfill the tray. You may take the side of the mixing tip and simply run it along the walls, and you'll have a nice, smooth, even surface to begin. Ask the patient to open. Place the impression tray in place, and it will self-center because of the design of the tray and the impression material. Simply ask the patient to bite, and we're going to have you hold this for 2.5 minutes. Never ask the patient to squeeze, bite hard, or squeeze hard. After 2.5 minutes, you may remove the impression. Simply rinse it and dry it. Take a scissors and trim the vinyl impression material back to the level of the tray wall. Do this for the top and bottom part of the impression. When your impression tip is ready to go and bled, you simply rinse and air dry the prep. Using a pigtail explorer, passively trace around the sulcus area, 360 degrees. If the tissue is dry, or if it's bleeding a lot, just simply trace again 360 degrees around the tooth. It's important to just trace passively with your explorer. Then rinse and lightly air dry the prep to be ready for the impression material. You apply the impression material, and this is very important, beginning on the coronal portion of the prep, using the smallest amount possible to cover the prep. You apply step 2 impression material in circular motions until you've covered the entire prep, including the sulcus. Again, use the minimum amount of step 2 material that you can. Never get step 2 impression material on the occlusals of the adjacent teeth. Place the tray by hand over the prep and have the patient close together. Tell them to close and hold for 2.5 minutes. When this is done, your step 2 is complete. And you're ready for step 3. Step 3 simply involves reviewing your impression with good light and magnification, checking for the following. Make sure that there is no step 2 impression material on the occlusals of the adjacent teeth. Make sure that you only see step 2 impression material around the sulcus of the prep tooth. There should be very, very little on the occlusal portion of the prep tooth. If this is what you see, you're ready to send your impression to the lab. Yes, it's that simple. The Miti system is self-contained. One Miti kit provides exactly what you need for 24 posterior impressions, 18 anterior impressions, with no wastage, no hunting for tips, no unnecessary expiry of materials, and instructions in every kit. It is extremely important that you do not substitute any other tray or polyvinyl siloxane to get consistently excellent results. You have access to the Miti Crown and Bridge free tech support line at 1-800-955-MITI, or contact us online at www.miticbs.com.